Hi everyone, my name is Amit Jain and I work as a medical oncologist at National Cancer Centre Singapore. In my day-to-day work, my focus is lung cancer, the cancer with the highest lethality by frequency globally. Anybody can get lung cancer. More and more, it is unrelated to smoking. It may affect young and elderly. It is not inherited. Factors that lead to lung cancer in never smokers are still being unraveled and continue to be an area of hot research. Lung cancer is quite insidious. Unfortunately, most lung cancers are stage 4 and incurable at diagnosis. This is because lung cancers are rarely associated with any symptoms in the early stages. There is, after all, a lot of space in our lungs for nodules to grow without causing symptoms. Sometimes, the earliest symptoms are cough, drop in stamina, shortness of breath, and insidious, slow onset, persistent pain, loss of weight and appetite, but unfortunately, by the time these symptoms are present, very often lung cancer is already widespread and incurable. So don't neglect these symptoms early. Common sites of spread of disease include lymph nodes in the chest, the lungs, brain, liver, adrenals, bone. So there is a direct but gradual impact on function, appetite, activity level, or breathing. Quite often, lung cancers picked up early are picked up by chance, on X-ray or CT scan performed for an unrelated reason. For those who smoke, there is evidence that performing low-dose CT scans can help save lives. A person who smokes is part of a group of persons who is at higher risk of lung cancer when compared to the general population. What about lung cancer that is not related to smoking? There are ongoing efforts, especially in East Asian countries, to study whether if low-dose CT scans can screen, pick up early stage and therefore curable, non-smoking related lung cancers, and therefore improve on early detection of lung cancer. While this is currently only being conducted in the context of clinical studies, today, there are ongoing efforts in parallel where some stakeholders are discussing national implementation and reimbursement guidelines in some countries. In Singapore, we are running a study called Solstice, where we are asking exactly these questions and conducting screening for lung cancer in healthy persons deemed to be at risk. With the reality that lung cancer is largely picked up as advanced incurable stage when it is diagnosed, there are two large goals at play. Firstly, to pick it up earlier, so more lung cancer is curable through screening efforts aimed at identifying higher risk individuals and conducted low-dose CT scans as described above. Secondly, to make more incurable lung cancer into a chronic disease that is no longer terminal. While many inroads have been made in molecular subtyping lung cancers, with now ever-expanding list of drugs approved for lung cancer treatment, lung cancer continues to be terminal and lethal. The aspiration to help improve the lifespan of these patients drives many of us to perform research. At your end, eat healthy, keep moving, and live a positive life so that the body and mind are strong to withstand treatment if ever faced with this diagnosis. Let's unite in building awareness for lung cancer as well as lung cancer research, so together we can also alongside help improve outcomes in patients who have this disease. Thank you.